everybody, Suzanne Kellner-Zinck with Dawn Visions Hypnosis, and today we are going to speak about bulimia nervosa in males, because it is different in terms of how the illness shows itself in males versus females. So what we're going to look at first is the Diagnostic Statistical Manual number 5, version 5, of what bulimia nervosa criteria is. Unfortunately, they don't really talk to what happens with men that's different than with women, but we'll get an idea of what this illness is all about. Recurrent episodes of binge eating, defined as consumption of an unusually large amount of food in a short period of time, accompanied by a sense of loss of control. Recurrent inappropriate compensatory behaviors in order to prevent weight gain, such as self-induced vomiting, misuse of laxatives, diuretics, or compulsive exercise. 3, these behaviors both occur on average at least once a week for 3 months. 4, regarding weight and shape as central to one's self-worth, overvaluation of the weight shape. It's important to point out that these criteria apply to both men and women in reality. However, that's not to say men and women express their symptoms in the same manner. So for women, it's all about cardiovascular exercise. It's about looking thin, but for men, it's very different than that. It has to do with masculinity. It has to do with an idea of having large masculine muscles and six-pack abs. And what happens is they're going to over-exercise to make that happen. However, the problem is that they have this thing called muscular dysphoria. And what that means is that they never see the growth of their muscles when they see their reflections in the mirror. Similarly to what happens to women when they still see themselves fat, even though they're just looking at a skeleton of what they were. Literally they lose all that amount of weight. So what we need to understand is that we have to look at it a little bit differently in terms of how we deal with the problem. In this case, it's about having the men be able to get rid of the compulsive idea that they will have to be a perfect male specimen in order to be good enough, worthy of love, worthy of whatever it is that got them to develop the bulimia in the first place, because there's always a cause for a problem before a problem actually occurs. There's a purpose for holding on to the problem. In this case, even though they may be out of control of their eating at times, at least they're controlling that tiny aspect of their life to some degree, or so they feel. And the exercise is also a feeling of control, even though they're overdoing it. Now, some of the interesting things about the statistics of how this is affecting people: 0.2% of American men report a current bulimia nervosa diagnosis. 0.6% of American men report a lifetime diagnosis of bulimia nervosa. 0.4% of Australian men report a current bulimia nervosa diagnosis. 1.2% of Australian men report a lifetime diagnosis of bulimia nervosa. The peak age of onset for male bulimia nervosa is 18 years old. Around 40% of men with bulimia nervosa make a full spontaneous recovery. Males represent up to 1/3 of all cases with bulimia nervosa in the general population. So they're about 1/3. So it's still a very large number of people involved. Now, it's very interesting that very little research has been done on bulimia in men and in males in general. And it makes it difficult for your conventional people in the mental health world to understand what works and doesn't work. And they're going to go into things like cognitive behavioral therapy. Well, let me tell you something. I'm a hypnotist and a master practitioner of neuro-linguistic programming. And the reason that I went that route instead of conventional therapy is because I understand that it's the subconscious mind that is the protector of the human being. And it's going to develop these weird ways of protecting the individual from hurt and to gain control in this case. even though it's gotten out of control by the time people are given this diagnosis. Secondly, it is only when we understand the purpose for this problem continuing that we're going to be able to release the person. These are basic concepts of neuro-linguistic programming, to tell you the truth. The other thing that we need is a compelling future that's more important than continuing to be sick, for the person to really find a reason to go through all the work that it takes in order to let go of an illness such as this. In fact, I would say that a compelling future is important to be able to do anything of any value in life, but most importantly for anybody who has a mental health problem that they've been working really hard to let go of, and they haven't found any resolution to it as of yet. I'll also say that the conventional model of therapy is outdated, outmoded, and has nothing to do with the reality that I have found from my own clients over the last 20 years I've been doing hypnotism and neuro-linguistic programming. I started with anorexics. They started coming to me, and bulimics too, because they had tried the inpatient process and they found it demeaning, demoralizing, and basically unhelpful. Why? Because all they were concentrating on was the actual behavior. The behavior is a symptom of a deeper problem, people. And the deeper problem resides in the unconscious mind of the person who has this problem. So until and unless you understand why the problem developed and why it's holding on, there's no way to get a person to stop these other behaviors. Zero. And we find this because if you actually did the research, as one of my past clients did for me, she helped me out a lot, you'll find out that these inpatient programs and the outpatient programs in eating disorders are less than 5% effective. That means 95% failure rate. And it's because they are not dealing with the underlying causes and purposes that these problems help in the unconscious mind. And these people do not know how to work in the unconscious mind, so how the hell are they going to help these people clear the problems and the cause? On top of which, whenever you have a person who has compulsive thoughts of feeling self-loathing, this is what my clients continuously tell me, that they loathe themselves. Until you can get them to fall back in love with themselves, there's not going to be any real energy behind getting help, because they don't feel worthy of the help. So the first thing they need is to fall back in love with themselves, because they didn't come out of their mother's vaginas hating themselves. It's something that they learned along the way in some kind of interpretation of what people told them earlier in life. And it doesn't mean that the person actually told them this. It's the way that it was interpreted in their child mind. Because we have to understand that between the ages of 0 and 8 years old or so, a human being is totally unconscious. They don't reason, they don't rationalize, they don't judge, they can't understand another person's perspective. So if a parent comes in and has a horrible day at work and is telling them, kid, to get the hell out of their way, that they're a pain in the ass and they don't mean anything, the parent doesn't really mean that for the child, it's just projection. But the kid is not going to understand this because they don't have the mental ability to. Their prefrontal cortex is not developed enough to be able to understand it in that way. So we have to understand what is going on and why it's going on. So in my treatment, we get the person to find their positive attributes and find a lot of reasons to love themselves, get in touch with the things that they used to love in life, and to go do those things. Find some curiosity again. We do a whole 4 sessions on addictions, because it is an addiction, people. And until you deal with it as what it is, you ain't going to be able to release it. So there's 4 hypnotic scripts and 4 neurolinguistic programming procedures that we use in each of the scripts. So it's 1 for 1. So each session has 1 hypnotic script and 1 NLP process that goes with it. And then we have these things called boundaries. People who have these problems have really bad emotional boundaries. They get hurt a lot. And a lot of the things that they do now is in order to help them understand that they're still alive. That's for the cutters and for the people who are doing these things that are stressing out their bodies in terms of trying to gain the muscle. Not good. These things need to stop, and they need to understand how any living being is able to not just survive, but to be able to grow and thrive. And that takes nutrition, and that's true of plants as well as human beings. So we explain this, and I give them the nutritional needs that they require, and we do some hypnosis around helping them to get those things into their bodies and into their minds, along with a reasonable amount of exercise. Because exercise is good, but not if it's overdone and stressing out the body that's malnourished and steroid-ridden, etc. And then we need to deal with the compelling future. What exactly do they want to do with their lives? And of course, this is age appropriate because it's going to be different for a 15, 16-year-old than a 21, 22-year-old or someone who's older than that. Though I will honestly tell you that I prefer to work with people who are under 26 years old for males and under 25 for females because their prefrontal cortex is still very imaginative. It's still able to do this work. And by the way, if you've been using the hypnotic trance state to do all these behaviors, because they're actually in a trance state when they're doing these behaviors, to do the self-harm, I can use that same ability that they've reached to help them to do healthy behaviors, have healthy thoughts, and work on what they want to create with their lives. So it is actually a really beautiful way to help people. The programs run anywhere from 6 months to a year. It kind of depends on the person and how long they've had the problem and how long it will take to release them. I'm going to tell you right up front that my price is $10,000 to get the deal done. And I don't care if it takes 6 months or a year, it's $10,000 all inclusive. You're not going to find a deal like that in any of the inpatients because their programs run $40,000 or $50,000 a month because they have to have people on site all day, every day to take care of the patients. Not that it helps anybody, really. The other difference is that when we have people with eating disorders together in a group, they're really good at perfectionism. And because of that, they learn from one another how to be the best at meeting the goal. For males, it's about how many hours can you work out and how lean can you get. We don't want our patients competing with one another in self-destructive behaviors. You want the person to understand what they're doing and what matters in terms of how they can do what they need to do. So doing this individually from the comfort of their home is really the best way to do it, because that way they're self-pacing and I can work with them individually to give them exactly what they need. I'm going to have the contact information for how you can reach me to talk more about the program if you yourself are finding yourself having this difficulty, and if you have a kid or someone in your life who you know is struggling with this. Thank you all for taking your time with me. Until next time, and have yourself a great day. Bye-bye all.